Hi, everyone. Hello to all of you leaders in the healthcare and the life sciences industry. It's really an honor to be here with you today. We all know what change means. Change means stress and anxiety. So, Dr. Ashton, let me start with you. What advice do you want to give each and every one of the business leaders who are joining us today about how to stay resilient themselves during these uncommon times?
Self-care is not selfish. And at the beginning of the pandemic, when I was working these completely crazy hours and feeling massive stress, both as an individual, personally, as a mother, professionally, I had to remind myself of those same pieces of advice and medical recommendations about how to not just maintain my, head above water, but to come out the other end with greater resilience. I think that some resilience is natural, some can be fostered and taught and practiced. And I think anyone in a leadership position, whether that's at home or in the workplace, has a responsibility to not only keep their own head above water, but to lead by example, because people's eyes are on us if we are leaders.
We had an inventory management software tool that we use to help ensure communities around the country have access to market shortage pharmaceuticals. And so when the federal government started to really engage with the private sector, we had really great conversations about how we could reshape that application to meet the needs of the government to ensure the COVID vaccines and therapies got into the communities that needed them in a very dynamic way, right? Flashback to hotspots and things like that. Mm-hmm. So that is something that we're really proud of, and being able to support the federal government in being able to ensure on an ongoing basis that the pharmaceuticals are able to get to the communities in need.
At the beginning of the shutdown, at the beginning of the crisis, there was a lot of discussion about the availability of PPE. We found a way to be very precise and on demand in the way in which we delivered PPE. So we received, working with our partner Zipline and our partners in the North Carolina Department of Transportation, we were able to work with the FAA and receive the first ever waiver to fly drones over long distances, over populated areas. And we had these drones flying 80 miles an hour over populated areas and dropping PPE to our facilities in an on-demand fashion. Our partners at the drone company Zipline like to call it as close as we can get to teleportation these days. So it's an exploration of those new modalities, new channels by which we deliver care that I think really accelerated during the COVID crisis.